Good morning, everyone. It's 11 o'clock, so we're going to get started. Good morning and welcome to the McGill Dementia Education Program's Caring Conversations, a free community outreach initiative to provide virtual support to care partners and people living with dementia. I have to let you know that today our multimedia specialist is home sick in bed, so we're managing the tech side of things ourselves. Hopefully everything will run smoothly, but we'll ask for your patience if we have any difficulties. So the McGill Dementia Education Program offers a comprehensive range of free resources to educate and support persons living with dementia, family and informal caregivers, healthcare professionals, medical students, and the public at large. An important resource is Dementia, Your Companion Guide, which is available for free in 14, soon to be 15 different languages. Printed copies can also be obtained on Amazon. We have also recently launched a free new online course designed to educate and support care partners of people living with dementia. It's available in English and French, and the content consists of 10 self-guided online modules that the learner can go through at their own pace. It includes expert advice, shared experiences from participants, and solutions to the challenges of being a care partner in the context of dementia. Caring Conversations is an initiative of the McGill Dementia Education Program and is supported by private donations. Now, let's meet our moderators. Lucy Barilak received her Master of Social Work from the McGill University School of Social Work. She has developed evidence-based training for seniors and caregivers. She has lectured in the field of social gerontology and presented in major conferences. Her research studies have been published in numerous journals. Ms. Barilak received the Queen's Jubilee Award for her role in developing a national coalition to support caregivers across Canada. Joanne Besner is an educator, professional coach, and caregiver. She received her Bachelor of Social Work and Master of Business Administration from McGill University. Her 35-year career in public community health care in Quebec spans many roles, including frontline case manager, clinical supervisor, manager, researcher, and trainer. Today, we're revisiting a topic that many of you may eventually confront, at least most people attending today's session, managing challenging behaviors associated with dementia. We ask that you keep your microphones turned off. We will unmute people as needed once we open the discussion. We also want to let you know that the information portion of this webinar, the part that Lucy and Joanne present, is being recorded and will be posted on our website. We will stop recording once Joanne and Lucy have completed their presentation so that those who might want to share but do not want to be recorded may have a chance to do so. So Joanne and Lucy, I let you go on. I think, Joanne, you're starting.
Thank you, Maria. Thanks for the introduction and welcome everyone today. We're happy you're here with us to launch the new season of Caring Conversations, our 2024-2025 season. And for this first session, we chose a topic that was really popular with you in the past. So we thought it's going to give us a chance to revisit, for those who have joined us already, the super challenging issue. And first, we're going to start with your voice. And what do I mean by that? When you registered, you were asked, is there a challenging behavior that you would like help dealing with? And more than 50 of you answered. So thank you for sharing your lived experience. And of course, I'm not going to share all those 50, but here are a few, just to get an idea of what your fellow caregivers have asked. How can I get my person to accept care tasks like bathing or accept help of any kind? How do I handle misunderstandings? Like when my husband is asking for a utensil when in fact he's looking for a kettle. What do I do when my person wants to shower at 3 a.m.? How do we deal with anger, tantrums, verbal aggression, and high emotions? What do I do when my husband wants to go to work and it's no longer an option? How do I redirect his behavior? How do I help him understand I'm just trying to change the subject? How do I make my wife feel like she's not abandoned, but it is her memory that's failing? How do I communicate in a caring yet assertive fashion? How do I deal with resistance and them always saying no? And sometimes, how do I deal with is just so slow? They take forever to finish doing something. And the last one I wrote in bold because it kind of sums up everything. How can we as caregivers avoid getting frustrated, exhausted, worried, and stressed? So what we noticed was a common theme of really emotionality. All of these things trigger emotions as caregivers. So what are we going to do today? First, we're going to define dementia and behavioral disturbances. We're going to also look for the reasons behind them. And as we always do, share tips and tricks to manage these behaviors. And our desire today is to be able to address the concerns that you shared with us. If we don't get to everything, or if you feel we didn't adequately answer, that's why we have the second half hour. So please write in the chat at any time and come and join our conversation and ask us to go deeper. That's what we're here for today. So getting started, what is dementia? So for those of you maybe joining for the first time or earlier to these concepts, dementia is an overall term for a set of symptoms that is caused by disorders affecting the brain. Symptoms may include memory loss, difficulties with thinking, problem solving, or language severe enough to reduce a person's ability to perform their everyday activities. Why did I put an umbrella there? You see this umbrella because I want you to imagine dementia is the umbrella term. And within dementia are all the specific illnesses, such as dementia type Alzheimer's, vascular dementia that comes from strokes, Parkinson's, Lewy body dementia, frontal temporal lobe. These are just a few examples. A person with dementia may also experience changes in abilities, mood, or behavior. And these symptoms are not reversible, which means any loss of their abilities cannot come back, at least today. We do hope that further research is going to change this. What are some of the early signs of dementia? Difficulty understanding, difficulty retaining recent events and information, memory loss and repeating questions, impaired judgment and reasoning, disorientation to person, place, season, and time, meaning don't remember who that person is, where you may be, what day, date, or month it is, and increased confusion and mood changes. So then what are behavioral and psychological symptoms of dementia? So these are what we're talking about today, difficult behaviors. And you can see on the slide in left, there are 4 initials in bold, BPSD, and that stands for exactly what I just said. And I'm sharing this because you may hear this term from your professionals, your team, or articles you read, and it's just a short acronym for these difficult behaviors caused by dementia. So what are they? Distressing actions or patterns due to an inability to communicate or to be able to do something. So these symptoms are a form of communication, an attempt of your person to convey their personal need through their behavior. As dementia progresses, communication becomes more and more difficult, and then language fails them. It's at that point that you may start to see these odd behaviors or psychological patterns like acting distressed, not being able to do something, or interacting poorly with others and interacting poorly with the environment. So what could these behaviors look like? Repetitiveness, over and over, asking the same questions, wandering, agitation, and even aggressivity. Sundowning, for those of you not familiar with the tool, it's exactly that. At dusk, somehow as the light starts to change, sometimes more behaviors come out. Screaming, sleep disturbances, resisting hygiene, and then these last three, sexually inappropriate behaviors, hallucination, paranoia, delusions. These are the most challenging, and I do want to mention that hallucinations, paranoia, delusions, we are going to be saving those actually to present to you in a webinar devoted to that next month, and Maria's going to be telling you more about that. So for today, we're going to focus on the earlier ones, but also in what you shared with us, I'm going to add, you added to this list in your feedback to us, you added anger, especially quick to anger in public, yelling at the TV, apathy, stubbornness, constantly pulling out clothing from closets, refusal to stick to a schedule, huge drama over nothing, humor on the verge of vulgarity or having no filter in social situations and accusations. And I want to invite you, if there are other behaviors, go ahead, add them in the chat. Maria's going to be checking them, and we'll look at those after we're finished our presentation. So why does this happen? Dementia affects parts of the brain that control a person's ability to control their responses. That's why they have so much difficulty with impulse control. The most important thing to understand about today's topic is it's not something they're doing on purpose. And you're going to hear Lucy and I repeat that throughout today. Whatever that behavior that the person's exhibiting, it's because they don't even have the insight to or ability to recognize that they're doing it or how it is impacting other people. They don't recognize how to express themselves properly. So it's important to know these are not their bad behaviors. It's not bad on the part of a person. They're caused by these chemical changes that are out of their control. Remembering it's not their fault can help us as a strategy to deal with it. So this is what is the most important thing. And I invite you to listen to this very carefully. BPSD, or these difficult and challenging behaviors, is often the most distressing part of the illness for caregivers to watch. It makes you feel helpless, exhausted. It contributes to fatigue and a sense of burden. And you're going to hear from us today explaining that your person's trying to communicate something to you in a foreign language. And you're going to hear us say it's your job to figure it out so that you can help them and therefore help themselves. But really, this is very difficult to do, and we want to acknowledge that right from the beginning. As a care partner, you're not going to be perfect. You're not perfect. You're not always going to be able to be patient and to say the right thing. And you may, despite what Lucy and I share with you today, you may not be able to do it, and it might not be able to, it doesn't always work. And you are allowed to get frustrated and say things that you wish you had not. So we want to just say that right from the get-go. Yes, we are going to give you tips and tricks, but it's okay if you can't do it or you can't do it all the time. We're going to tell you that you need to have empathy for the person, but the message right now is you need to have empathy for yourselves. Now, you may want a magic pill to make this all go away, and there are some medications, but what we're going to do in today's presentation is give you options to try before resorting to medication. So what is this message that they're trying to give us? So it could look like this. And you can look at the little figurines. It could be that they're simply tired. It could be they're trying to tell you they're in pain. They're uncomfortable. They may be hungry or thirsty. Maybe they need the bathroom or they've already soiled themselves. It could be they feel too hot. It could be they feel too cold. They may be afraid, lonely, bored. They could be excited. They could be angry or upset. What is their message to us is what we're trying to figure out to understand what their potential needs are. So how do we do this? How do we figure out what this mystery is? Rule number one, we want to rule out physical illness. And this is actually the good news. If these behaviors are happening because they are not feeling well, these behaviors then are reversible with treatment. So you want to be, first before anything, consulting your physician. If they are in pain, they may have lower high blood pressure, symptoms of heart or lung diseases, just like simple flus or pneumonias, certain vitamin deficiencies. All these can cause behavior disturbances as well. Even UTIs, urinary tract infections. Dehydration is a big one. Are they eating and drinking properly? So all these things, the first thing you want to do is see your physician for your care receiver and rule out a physical illness. If this is the reason and the cause for the behaviors, then once they are treated, the behaviors should reduce and disappear. If you have done this and it is not the case, then yes, the behaviors are due to dementia, and it's at this point that we have to understand and meet their needs. So, where do we start? To understand the needs of a person around their care, around the type of socialization they need, around the type of stimulation they need, we need to pause. We need to step back. And we need to ask, what's happening here? This is odd, this behavior. Let me stop and take note of this. So we recommend that you have a journal around, a notebook and a pen nearby on your coffee table available, so that when these behaviors happen and you really want to take note of it, the book is available. And what do we ask you to do? Step back and observe what's happening and make a little note. What happened? Write down the incident. What was the behavior? When did it happen? What time of the day? And then try and think, what exactly happened right before? What triggered them? And we think of their five senses. What did they see? What did they hear? What did they touch, smell, or even taste? What's happening in their environment? What triggered them? Was it before or after taking a shower? Was it before or after? I think somebody needs to put their button on mute, Maria. Thank you. What triggers them? So we're looking at, what was planned in the day? Is there an appointment planned that might be upsetting them? Were there visitors before? Are there visitors coming? So you want to just really look at, okay, what's happening? It's no different than if you have an allergy and you have an allergic reaction and you want to say to yourself, okay, what happened right before to cause my allergic reaction? And you want to take notes. So we want to try to get the data to figure out what's happening. Are they acting out when they're in a bed? Are they in a chair? Was the TV on really loud? Was the radio playing? So we call this technique watchful waiting. Observe and note, try to get the data, because sometimes simple adjustments can make all the difference. Also, look to if you have private care attendants, it's important to have this discussion with them as well. What are they like? How do they interact with your person? Do these behaviors happen when they're around and the same rules applied? We gather this information and then we use it to make changes. This is where I am going to pass you to my colleague, Lucy Barilak, and she's going to get into the specific tips.
Oh, thank you so much, Joanne. Yes, so let's look at these tips. But before I start, I want to say that communication is key. Acceptance is very important. they will not change. It's you that has to adapt to a new way of communicating with them. And that will be helpful to both of you. So as Joanne said, we now know all the symptoms of dementia. They cannot communicate, they have difficulties. So communications and acceptance. I'm going to be repeating myself a lot, but it's kind of the whole pattern of what we need to do. And it takes a lot of practice. It might not work the first time. So the first and the most important thing is to be patient. All right. And we say talk one-on-one, face the person. What you're trying to do at that point when the behavior escalates is to get their attention, is to be able to look them in the eye, call out their name. Also, be brief, break it down, use simple words that you think that they will be able to recognize. And as Joanne said, recognize the triggers. What happened just before? Another thing that when I talk about talk one-on-one is, simply smile, connect with the person, hold their hand, use their words, ask them a question. Are you okay? I'm here for you. Are you thirsty? Be aware of your nonverbal and your tone. They may not understand your words, but they might pick up on the fact that you look very angry or that you're upset, and that will trigger something in them as well. The other thing is pick your battles. Is it really important to deal with this? Is it such an important issue? Focus on the quality of life for both of you. Behavior management. Okay, we're talking about the whole idea of creating a routine, a way of dealing with things. And the other thing is, and I'll be more specific in later on, diminish distraction, especially hard background noises. Or if you see them passing a mirror and they get scared, for example, they may not have recognized themselves. And the other thing is, if it's not working, stop. Okay? Don't bang your head against the wall. Wait a bit and try again. Now, daily activities can be very challenging when the person refuses to cooperate. And so I'm going to use the example of bathing, but it just goes for all kind of difficult situations that you're in. And again, be patient and give yourself time. If you're going to do a task with them and you have other appointments coming up, you need the time so that you're not stressed and you're not rushed. So again, I'll use the bathing as an example. Obviously, make sure that the bathroom is adapted to the needs of the person that you're caring for. And these are, prepare the bathroom in advance, meaning bring the towels, bring their clothes. You never want to leave the person there. So, running out, it could be dangerous. And the things that we're talking about is create almost like a spa day, because you're giving yourself the time, whatever activity you're in. So with bathing, make sure that it's warm, test the water. Use sometimes caregivers even use music. Music is wonderful to distract anyone who's having a difficult time at the moment and allow them to cover up. I know my mother, who suffered from dementia, always wanted a towel around her. She was very private. And the whole idea of using distraction. One caregiver told me that she would put a bowl of strawberries, and every time her mom sort of behavior changed, she would offer one, and that was very helpful. And, do not spend time and energy trying to reason with the person at all. And the other thing I want to tell you, bathing is not necessary every day, and that goes for any other activities. So if you're not up to it, do it another day. We had questions about wondering and repetition. Okay. So wondering is really very difficult. But I think, as Joanne said, we have to look for the immediate cause. What happened all of a sudden? Why is this person wanting to get out? So we want to be able to distract them and redirect them and to doing something else. Now, some people go as far as moving the locks on the outside of the doors out of reach, even disguising the doors with a painting, a wallpaper, a mirror. Ensure that they get regular walks and exercises. Now, the important thing is to remove triggers to go for a walk, like a coat, a hat, and a cane. So put them out of sight, out of mind. Now, the other thing is use safety ID bracelet and informing your neighbors, the people around you, that if you see them on their own, to please get back in touch with you. Now, this one was another big one, repetitive behavior. If someone repeats their words and actions over and over again, it's so hard, but actually do nothing. Go along with the story and try to distract them with simple activities. Change the subject and stay calm. If you start telling them, you just asked me that, you're getting angry, they're getting frustrated, so do nothing. We had questions about inappropriate sexual behaviors, but before I start looking into that, I really want to talk a little bit more about sexuality in general, because we know that sexuality touches our own values, systems, our culture, our beliefs, our religion, as well as how we ourselves feel about sex, especially as we age. And what I want to say is we all need human contact. It does not decline with age or dementia. Sexuality and intimacy are a fundamental part of human existence. We all want to be touched, we all want to be hugged, and the most important, we all want to feel that we're loved and taken care of. Some people feel they're not comfortable talking about sex or intimacy. So I think we kind of all need to look at ourselves, because that, if you feel that you're not comfortable with that, will add even more pressure to yourself when this behavior escalates. But the other thing is those with dementia communicate with behavior rather than with speech. So if their actions appear to be sexual in nature, it may not be the cause. They may be have a urinary tract infection and they're touching themselves, or maybe they need to go to the bathroom, they're pulling off their clothes, they're cold, they're hot. There are many reasons. That's why it's always so important to try and understand what is actually going on. So let's look at inappropriate sexual behaviors. What are they? So there's sexual advances towards others, masturbating or fondling genitals, sexual language and explicit commands, removing their clothes, exposing themselves in public. So what I want to tell you, that many caregivers tell me that when the person behaves this way, they feel ashamed, disgusted, angry, embarrassed for the person and themselves. And I can certainly understand why. Okay? It's difficult. It's unpleasant. But I do want to just stop and talk about masturbation for a minute. Obviously, if they do it in public in front of other people, well, it's difficult to handle that. But if they are doing it in their own privacy and they're comforting themselves, and even if you feel like repulsed by it, I would say that please leave them alone if it's not disturbing them. All right, so we've talked about all these tips, but now I want to be a little bit more specific about how to handle that. So here are some tips which we talk about, and we've been talking about deflating, distracting, redirecting, but I want to be a little bit more specific. And again, always keep calm and remain supportive and be patient, okay? Deflecting is what we're talking about is when you want to deflect is you want to get their attention. You want to call out their name. You want them to look into your eyes. The other thing that is very important, don't argue or try to correct them. It's not going to help, and it's only going to frustrate you for all the reasons that Joanne was talking about. They're not doing this on purpose. It's the disease that is affecting that behavior. Again, be aware of your body language, your tone, your voice, your facial expression, and try to figure out what are the triggers. Again, do they need to go to the bathroom? Whatever it may be. And watch for nonverbal cues from them. So if they're tagging at themselves, they might need to go to the bathroom. So what you want to do is you also wanted to distract them. So, you deflected a little bit, you got their attention by asking them a simple question. What can I do for you? I'm here for you. You're not alone. It's okay. I'll take care of things. And the most important thing is once you got their attention is to redirect them to a new activity. So what do we mean by that? You got their attention, do something different. Take them for a walk. Do some reminiscing. Have albums there ready. You can watch TV. Music is amazing. Sing along. Give them something to do. Provide cognitive stimulation, which is so important for them as well. What I would also suggest is to have activities ready in a drawer or a box. You don't have to go looking for a piece of paper. It's handy. You're doing that. You know, it's so very important that if the person becomes aggressive, verbally, physically, or sexually, put a plan in place. So what do I mean by that? Make sure to ask a trusted family member or friend, would they be willing to come over if you're having a difficult time with them? And so what I want to say, if the behavior escalates, worst case scenario, you may have to call 911. If they're being aggressive, verbally, physically, don't go near them. Stay away. You want to protect yourself and you want to protect them. And many caregivers say to me, well, it only happened one time. Well, I want to tell you, if it happened once, it can definitely happen again. So we talked about all these tips that need to be practiced. They don't, as Joanne said, they don't always work. So if all else fails, there are medications, and it's okay to speak to your doctor about them, just to calm them down a little bit. At the same time, Joanne and I always say, it's a balancing act. There are two people in this relationship. One does not outweigh the other. And so it's important to be able to take care of yourself. And if all else fails, sometimes we do have to look at relocation.